12 signs that shows your blood sugar is high. There are several external signs that can indicate high blood sugar levels or hyperglycemia. Some of the common symptoms include frequent urination or polyuria. That is how I got to know I have diabetes. When I was waking up at night to go to the toilet, my wife asked me to go and check my blood sugar. Needing to urinate more often than usual, especially at night, is most likely the first sign you or somebody in your family notices. So, it may be worthwhile to see anybody in your family go to toilet at night. Do not try to tackle this by not drinking water at night or in the evening, because that makes you dehydrated and makes things worse. Less water, but high sugar makes blood more concentrated and damage other organs. Increased thirst or polydipsia. Because you are passing too much urine, it is common to feel very thirsty and unable to quench your thirst. Are you feeling very hungry even after eating, because the body can't use the food for energy? This is called polyphagia. Maybe you have insulin resistance, which is the first thing developed in type 2 diabetes long before any symptoms appear. Explained simply, you have both insulin and glucose in your blood, but they can't push glucose into the hungry cell. Experiencing blurry vision or vision changes or difficulty focusing. When blood sugar levels are high, fluid can leak into the lens of the eye. This causes the lens to swell and change shape, which makes it difficult to focus light properly on the retina, leading to blurred vision. This type of blurry vision is usually temporary and goes away once blood sugar levels return to normal. See the video in the above link about tricks to bring the blood sugar levels to normal quickly. Feeling unusually fatigued, tired or weakness. Having more frequent dry mouth or dry, itchy skin. See the video link above to learn about 10 ways to lose weight. Slow healing sores or cuts and other disease. Noticing that cuts and sores are taking longer to heal. Even though it is not listed in the medical books, the first two signs I should have noticed are a cough that does not go away and also a skin rash that persists on the legs or hands. Urinary tract infections or experiencing frequent infections, such as skin infections. Urinary tract infections are more common among women. There is a more detailed video about urinary tract infections in the above link. Feeling more irritable, angry or moody than usual. High blood sugar levels can trigger the release of stress hormones like adrenaline. This can cause a fight or flight response, leading to symptoms like anxiety, restlessness, and a shorter temper. You may get the same or similar symptoms due to low blood sugar or hypoglycemia as well. I almost lost the job due to a similar situation, because I blamed my manager heavily using foul language for some small thing because my blood sugar was out of control. For more reasons for being irritable, angry or moody, see the video in the above link. Experiencing frequent headaches. Nausea or vomiting. Feeling nauseous or vomiting without an apparent cause. When you have diabetes, your body has trouble keeping your blood sugar at the right level. If it gets too high or low, it can make you feel sick and cause problems if not treated. Why does blood sugar get high? There are many reasons why your blood sugar might get high. Here are some common ones. Not enough insulin. Insulin is a hormone that helps sugar get into your cells to give you energy. If you don't make enough insulin, your blood sugar can rise. If you are a type 1 diabetic, it may be that you have not taken enough insulin. Too many carbs. Eating a lot of foods with carbohydrates, like bread, pasta, and sweets, can make your blood sugar go up. Less exercise. If you don't move around much, your body doesn't use up as much sugar, so it stays in your blood. Stress and emotions. Feeling stressed, excited, or angry can also make your blood sugar rise. Illness. Being sick can make your blood sugar go up because your body is working hard to fight the illness. Checking your blood sugar regularly is important. Use your blood glucose meter to see what your blood sugar level is, at least a few times a day. Check for ketones. If your blood sugar is really high or over 300 mg per deciliter or 16 mmol per liter, check for ketones in your urine. Ketones are acids that can build up when your body uses fat for energy instead of sugar. You can check blood or urine for ketones, but the results might be different. Checking blood for ketones will give you real-time results, just like when you check your blood sugar. A urine check will tell you what your ketone levels were a few hours ago. If they remain high, it may cause ketoacidosis, which is a serious condition. If you have ketones or if your blood sugar is high 3 times in one day, call your doctor. They might need to change your insulin dose or give you other instructions. The best way to avoid high blood sugar is to follow your diabetes care plan. Here are some tips to help you keep your blood sugar in check. Take your medication. Make sure you take your insulin or other diabetes medicines exactly as your doctor tells you. Follow your meal plan and try to eat balanced meals with the right amount of carbohydrates. If it keeps happening, you may have to reduce your carbohydrate intake or change your food habits to lower carb options. There are great and tasty options in the hundreds of types of legumes to replace rice, wheat and potatoes. See the videos at the end of this video for great meal options suitable for diabetics. Stay active. Do not sit down and watch TV or YouTube continuously. Watch YouTube on mobile while walking inside the house or outside. Get plenty of exercise every day. It helps your body use sugar for energy. Check your blood sugar often. Keep an eye on your blood sugar levels throughout the day to make sure they stay in your target range. Follow sick day rules. If you're sick, follow the special instructions your doctor gave you for managing your blood sugar. When to get help. Sometimes, even if you do everything right, your blood sugar can still get too high. If that happens, don't panic. Here are some times when you should get help right away. Can't keep food or fluids down. If you're throwing up and can't keep anything down, call your doctor or go to the hospital. Blood sugar stays high. If your blood sugar stays above 240 mg per deciliter and you have ketones, get medical help or go to the emergency room. It's really important to keep your blood sugar in a healthy range because high blood sugar can cause problems over time. Here are some things that can happen if your blood sugar is high a lot. Heart problems. High blood sugar can hurt your heart and blood vessels. Nerve damage. It can damage the nerves in your body, making you feel numb or in pain. Kidney damage. Your kidneys can get hurt and not work as well. Eye problems. High blood sugar can damage the blood vessels in your eyes, which can lead to blindness. Foot problems. It can cause sores and infections on your feet that are hard to heal. Living with diabetes for over 40 years has taught me a lot. I've had times when my blood sugar was too high, and it wasn't fun. But by paying attention to the signs and following my care plan, I've been able to manage it. Remember, you're not alone. There are lots of people who can help you, like your family, friends, and doctors. Managing diabetes can be tough, but you can do it. Keep an eye on your blood sugar, follow your care plan, and don't be afraid to ask for help when you need it. By taking these steps, you can stay healthy and feel your best. If you have any questions or need more information, talk to your doctor or diabetes care team. They're there to help you every step of the way. Stay strong and take care. You are not alone in this journey. Do not forget to click the like button and subscribe. Up above you see few videos related to managing blood sugar levels and diabetes. Thanks very much for watching this video.